Good morning, everyone. I'd like to call the meeting to order this morning. Appreciate everyone being here. The first item on our agenda is approval of the minutes from the last meeting. So you have in your packet or perhaps picked up the minutes from the last meeting, and I'll give you a couple of minutes to look through those and see if you have any changes you'd like to make. As we're looking at those minutes, I would like to welcome our new board members. So Dr. Guzman and Leah Voss are here. Lee Voss. Sorry, it's okay. Lee Voss.
My mom didn't know how to spell
it. Very good, Lee Voss. And then our other new board member is Dr. Beverly Lee, and she is not able to be here this morning. All right, so in the orange folder is our agenda and also the minutes from the last meeting. And we're just now taking a look at those minutes from the last meeting. Is there any discussion regarding the minutes, and is there a motion to approve them?
I motion to approve the minutes.
Is there a second?
Second.
Okay, so it's been moved and it's seconded to approve the minutes to the last meeting. All in favor, please say aye.
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 Anyone opposed? All right, that motion is carried. And then we'll take additional items to the agenda. Does anyone have any additional items they'd like to have added to the agenda for today's meeting? Okay, there being none, is there a motion to approve the agenda?
I motion to approve the agenda.
Is there a second to that motion?
A second.
Everyone in favor, please say aye.
Aye.
Okay, our agenda is approved. Moving on to the financial report. Joe, would you give us the financial report?
Sure. I completed the December billing for the local public health community service grant, and it was for $16,984.51. That's between both the VNA and the city health. November's billing, since that was done after we met, was $19,156.08. So the two together, the total is for $36,140.59. Now, this is a grant that was for $210,456. There is a 3% hold that the state holds back. That is normally released. The hold is released in February or March after legislation approves it. Last year, they did not release that 3%. So that comes to, the hold is about $6,314. So we have spent a total for this year, which we should be at 50%, we've spent about $100,844.01. And we have, with the hold in there, $109,611.99 left, about 48%. So we're kind of right on target for, depending on whether they take that hold and they have been known to do that, to take more money back, depending on what the legislation will do, so.
Do we have a financial statement in our packet?
No, we do not.
Do we every month know, or we don't have
I usually give it
expenditures?
orally. I can certainly put it in there if that's what you
I'm
want.
just asking because of my job. Every month we have expenditures and
And
it's all documented and
do you want that broken down by
each entity for the month.
city
or
health, county, what city health does, what county does?
It'd be on one spreadsheet, but
And then do you want it broken down by every activity?
whatever is your main, spending and income and spending and for the month.
I can do that for what the grant is, yes, sir. The grant is one of these that they give you a lump sum. So some counties that I have worked with in the past will spend it all by 6 months.
I see.
in the time that I've worked here. We've never done that, just for the simple reason that what do we do with services after that point?
Sure.
And as we go on, we'll kind of talk about services when we get down to the public health piece.
Oh, okay.
So,
Thank you. Are there any other questions or discussion? Okay. All right, under old business, in your folder as well, you'll find a document that is called Conflict of Interest Policy. And this is a policy that we sign on a yearly basis. We just reviewed at our last meeting and approved that we needed to have each member sign. So as you review this conflict of interest, actually an action that each of us as board members need to take to sign. But I'm going to give you a few minutes to again read through that, see if you have any questions or concerns about that before we proceed. I think key to any group or board that you would serve on, if you have a direct conflict of interest with your job or your position or whatever, and items that we're voting on, you may have to abstain from voting based on that conflict of interest, and it needs to be declared before the board.
Do we have any current business with CHI, Allegiant?
No. Not that would be a,
That'd be my only potential
Yeah.
conflict, or if anything does come up where we would be doing business with them, I'd just
Mhm.
abstain from one of those votes.
Okay. I think Amy, you have the same,
Yeah.
Situation.
Family Inc.
Okay.
and I work for Children's Hospital. You know, it's all, we all
Right.
are.
So I work for Potawatomi County, so what's that conflict?
Well, Maggie, I don't know if that's one that would be of a greater conflict or not. As she works for Potawatomi County, we're voting on things specific to financial,
Well, Lee's not really she's a payer, but she's not really a decider for the county,
Right.
so to speak, so. The positions themselves, Lee working for the county, it's not a conflict for her to be on the board, just, you know, they're not, the two positions don't, they're not, under the law, she can have both positions, so. It's just gonna matter on the issue, I suppose. So I just recommend if there's gonna be an issue on the agenda and you have a question about it, ask beforehand. We'll look into it.
Excuse me, Maggie, don't you have to have a personal, gain before you can abstain?
You can always abstain from a vote voluntarily if for some reason you just feel it was inappropriate for you to vote. A true conflict is one of which you might benefit personally from what's going on. That's what I said. Even Lee isn't really a person who makes financial decisions for the county. She's, as the treasurer, the elected official that pays bills once somebody else approves them, mainly the board of supervisors. So I don't really see the business of approving whatever goes on with the county as being a conflict for Lee, either in her position or personally, but it's always one of those things where you don't know until the issue comes up, and so we'll ask about it when the issue comes up and look into it.
Thank you, Maggie. Is there any other discussion? Okay, so as we proceed with the meeting, this doesn't require a motion. We'll just see if we're ready to sign it at the end, and I'd like to gather those up at the end of the meeting if we could. Moving on to new business, the first item in our new business is transition planning. And I just wanted to do a brief discussion and wrap up or next steps from the meeting that we held with our consultants in the state team and our county, city, board group that we worked with. So I think in my mind, our next steps are that we have a few, some pieces of work to do. One being, our board, the Board of Health, needs to meet with the Board of Supervisors and look at, the memorandum of understanding or the written contract of our relationship between the two and the steps that we need to take to go, to get those things in writing, which we haven't had in writing before, as they recommended. Following that meeting and discussion, we'll begin to work with the transition of contracts from the city of Council Bluffs to Potawatomi County as those things appear. So in the first part of that is just, I believe Matt and Maggie and I will get together and kind of review the recommendations that we received from the state and have that agenda put together so that then we can come to the Board of Supervisors with that in mind and we can meet to see where the next steps go. Is there further discussion about that? Questions, concerns, or other suggestions?
So you'll have a meeting and then you'll decide? We'll
So-
decide, or what, I guess?
So I think that Matt and Maggie and I will have a meeting and we'll look at, they gave us, you know, the
contracts that
the-
have to be.
right, we
Switch.
won't specifically outline those contracts, but more the steps that the Attorney General talked with us about. There were like 10 points of things that we needed to put together and that thing, and just kind of look through that checklist and identify the things that we think we need to specifically talk about with the Board of Supervisors, and then we'll get that kind of organized, and we'll schedule a meeting between our board and their board. I'd like to do my meeting with Matt and Maggie next week, and then hopefully following that, we can get a time with the Board of Supervisors. Tim, that would be a separate meeting than your usual Board of Supervisors meeting, I would assume.
You know what, Chairman Beadle, or Chairperson Beadle, whenever you set it up, we'll make it work.
Okay, so we'll just try to coordinate. And timing-wise, this is kind of our best time to talk about timing. So what kind of timing works for you guys? Is it better to do it? I don't know, I assume that meeting could take us a couple of hours. I don't know. Daytime, evening, early
Friday
morning?
mornings, this
This
is
is
actually my
great.
best time.
Friday morning is a good time?
Right. Earlier, better.
I just have to know ahead of time so I can block out my time.
All right, so everybody likes this time of day. Okay. Very good. So I'll work on that and be in contact with you. Email contact, okay, or,
That's perfect.
okay. So I'll keep you abreast of that as we get things scheduled and going there. So I think that there's not really any motion or anything that we needed with that transition planning. I just want to keep us all abreast of the steps that we need to take as we roll this together. All right, the second part of this transition planning is some discussion about and decision about appointing Matt Wyant, and you all know Matt Wyant, right? As the contact person between the Iowa Department of Public Health and the Board of Health and the Board of Supervisors, as those different contracts come up and we need to work on that transition, just so there is a key contact person and we kind of are all informed in the same way. Matt's available.
It was kind of my takeaway from the meeting that we had with the state there at the library, that they were kind of looking for a contact person that they could reach out to. I'm here every day in the office, available to reach out between the Board of Supervisors, Board of Health, and the Iowa Department of Public Health, also working with the city on their transition. So I'm fairly well up to date on where everybody's at on the different issues. But I think that the other part of what the Iowa Department of Public Health made pretty clear is that they wanted to make sure that we're taking the proper steps. And I think the proper step would be to make sure that the Board of Health appoints someone as the contact person. instead of me just acting as that person. So to have that from you all, I think would be a good step for the Iowa Department of Public Health.
So the suggestion is to appoint Matt as the contact person. There could be motion or suggestion if you feel there's other people that you'd like to approve, or we can just, so do you have a discussion on that?
No discussion. I think that's a reasonable next step. Matt's in a unique position to see all the different moving parts, and I think that makes him an ideal point of contact with the IDPH, BOH, and BOS.
All right, is there any other discussion? Could I
Motion,
have a motion?
motion to appoint Matt.
So moved.
Yeah. And second?
Okay. So I have a motion and a second to approve Matt. Is there any question or other discussion? All in favor, please say aye.
Aye.
Anyone opposed? Okay, that motion is carried. Moving on to our next point of business, and that is the update on the recycling center efforts in Potawatomi County.
We have finally come to almost the opening date, so I have some invitations for you all for the ribbon cutting, which we are going to hold on January 27th. The contractors are actually still out there working like crazy right now, but we're gonna start accepting recyclables at the facility on that date. And, that, we won't take any MSW or C&D at the household garbage. That's gonna remain at the transfer station for about a month. And we're gonna hand out flyers. We're trying to do, somewhat of a seamless transition as you can, I guess. We're gonna hand out flyers at the transfer station for everyday users, letting them know that in 3 weeks, the facility is gonna transfer down, in 2 weeks, it's gonna transfer down, and then finally that we are gonna transfer all of our, solid waste needs down to the new facility, and Hancock will no longer be open. But we're pretty excited about this place. We actually now have outreach. We have a trailer and trainer that's set up for recycling. We also just now positioned a trailer in the city of Crescent down at their city shed that is available for rural residents. And we worked out partnerships with them that the cities maintain the site, and they also watch the levels of the trailer. And once it gets to where it's gonna fill up, then they call us, we come and pick it up, and then that way our staff does not have to constantly go out and around to police and make sure that people aren't throwing trash around the area. And everything that goes into those trailers that we bring back to our recycling center, we are now going to be able to bring in some kind of profit to the county rather than operating in the fashion we had been where we were paying to get rid of everything. Jacob Head is our recycling manager that we hired. He came to us from the Nebraska Department of Roads. He's gone over to Omaha and he's made contacts and relationships with First Star and a couple of the other companies who are going to purchase all those recyclables from us. And the good thing for us was we were working into this with the Citizen Task Force that made these recommendations and things, is that they said the recycling market fluctuates horribly. So some of these recyclers were holding on to a bunch of materials, and some people were, then they, to a point where they actually had to finally sell them, and they thought, oh, we're just getting pennies on the dollar for what we have here. For us, this is all new income. So whether that recycling market's way down or it's way up, it's going to be income coming into the county that we had not seen before. And hopefully that this facility is really going to be a kind of a staple out there in the community. We're going to have a lot of community programs set up there. We have our swap shop area set up. That's going to be where people who somewhat similar in nature to what Habitat for Humanity does with their restore down there. There's a lot of good materials that come through that transfer station all the time. And the guys used to just set it off to the side. We didn't have a whole lot of room in that building. This facility here, we have a room just about the size of this that we have shelving racks in, and they'll be able to bring that material in, set it on those shelving racks. Anything that the county residents or city residents can recycle comes into this place for free. The only thing that they're paying for is tires, appliances, and their household garbage they're gonna have to start paying for, and construction debris. So they'll circle around, empty off as much as that they can recycle firsthand, and then they'll come back through and scale again. But, it should be a really great thing. And hopefully supervisors will get this bond issue approved, and then we'll have a new building constructed out there, and then no waste will be outside. That's kind of a big thing with the DNR. They want all your storage stuff to be placed inside. And with some of the wind issues that we've come up across with at our location just north of Oakland, there's quite a bit of wind standing out there. So, but some of the educational programs that'll go through there, we're going to make connections with the local schools. There may be possibilities for them to come out and do small engine mechanics on the lawnmowers that get dropped off to us. We're going to rehab bicycles, and the amount of bicycles that comes through that place is crazy. So we'll be able to have the kids out there working on bicycles and putting them there for others to come and utilize and take with them. But the whole idea for us is really trying to cut down on our solid waste footprint at the landfill, and I think we're going to be able to do a really good job at this thing. So on the 27th, we're going to do a little ribbon cutting ceremony, and we'd love to have you all out there.
Sounds like a great project, and do what you can to get the word out too, and get people recycling a little bit more than maybe they already do.
Mm-hmm.
Could you maybe send that out electronically, invitation?
Yeah.
Is your goal to have them in all the cities around or in the county or?
It will
Like a
eventually probably
container?
expand to that. The task force that we had come together made a recommendation to start out with 2 outreach spots.
Pilot, more
Yeah.
or less.
See how the 2 outreach spots go, and then conservation actually wound up getting a grant from the DNR, so they got 5 recycling trailers now, and they positioned them at all of the county parks. And county residents or anybody can drive into there and utilize those trailers as well. So with the parks and us, really, we've covered the entire part of the county there that we would have wanted to reach.
So the park recycling comes into, I mean, are we in competition with any other? This may sound like a stupid question, but I honestly don't know. Are we in competition with any other recycling people that pick up or?
No, luckily we've partnered with the city of Council Bluffs, and they were fully involved in the process of the development stages of this facility going in. And so we will take some of our recyclables to them, and they are gonna actually help market some of our recyclables for us. So they really helped kind of set us up with the programs. Since they've been through it all already, we didn't figure there was any reason to kind of start anything new. They've seen what programs work and what didn't work for them, and so they really helped kind of guide us in that fashion. The only parts that we're doing that'll be kind of new to that will just be the involvement with the schools and bringing the schools actually out to our facility and having like a classroom style area out there for some activities to take place. We have some large concrete structures out there that for the dumping of the materials in, and this summer we're hoping to have the schools out in that area come out and paint their school mascots up on them, and just to try to get them involved in that way. Kind of initial foot in the door.
Yeah, that's great. All right, any other questions or discussion? Okay. Chris, the WIC update. In your folders, there's a document that looks like this.
I did give you a WIC report and an invitation here. Just a little bit of background. My name is Chris Wood, and I'm the WIC program coordinator. We do have 3 grants that run through our office. We have the Supplemental Food Program for Women, Infants, and Children that serves pregnant women, breastfeeding women up to a year, postpartum women to 6 months, infants and children up to their 5th birthday. We also have a breastfeeding peer counseling program, and we also have the Child and Family Resource Network, or coordinated intake, that's granted through Promise Partners. And that is to help with referrals to families for home visiting programs. So what I do is give you just a little bit of information about our monthly caseload. We have 2 clinics, one in Avoca and one in Council Bluffs. Just because we are not centrally located as far as county services, and Avoca is the biggest town that's the farthest distance away. So that's why we chose Avoca. It's not a huge clinic, but it does serve those families and keeps them from having to drive that 30, 40 minutes to get here. At the bottom of this report, you'll see just a couple of points of interest. We have submitted our 2017 year-end reports for the WIC and the breastfeeding peer counseling programs, and those have been accepted by the Iowa Department of Public Health. Currently, we are meeting the assigned caseload level of our current grant. We have 2 action plans. We have a nutrition education action plan, and that is surrounded by trying to become more client-centered and using materials that are more client-centered. So we have chosen materials from Getting to the Heart of the Matter. It's some Massachusetts-based WIC items that we're giving them a try. Learning new methods is not easy, but we're working on it. Our breastfeeding education action plan centered around starting a local or a county breastfeeding coalition. We had not had one in Pottawatomie County before. We have completed that task. So we've been meeting for a couple of months now, but you do have the invitation to our next meeting. That is January 29th out at Family Incorporated. We did call it the Southwest Iowa Breastfeeding Coalition because a lot of our partners work with more than just Pottawatomie County. So that's how it ended up being named the Southwest Iowa Breastfeeding Coalition. But the goal of that is to bring together those that are trying to promote and protect breastfeeding for moms, and because we do feel like it's a huge health issue. Breastfed babies just tend to be healthier, so we are trying to make sure that we increase our rates, which when I came almost 9 years ago were pretty low. They've increased significantly since we've started the breastfeeding peer counseling program, and really promoted breastfeeding and supported it more. And then our other program, the Child and Family Resource Network, or Coordinated Intake, we're focusing on some rural outreach right now. So we've been out trying to get to the doctor's offices. They're out to Dr. Guzman's office a couple weeks ago and getting out there and getting the word out. Do you have any questions about our programs, or?
What's your online presence? I know a lot of young mothers are going out to online mommy groups and getting most of their resources online.
We do try to use, and that's part of the coalition, is to this really, and that's what this comes from, is also trying to get our partners and us all using some of the same materials so that we're all giving the same messages. There's a couple of other websites that a lot of the providers like Kelly Moms and things like that. So we're trying to kind of identify those common good websites to send people to.
I was just wondering more along the lines of like a localized website, someplace where a mother here would say, you know, I want to know about breastfeeding resources. Are there any support groups here?
Sure.
Just go online, Google it, Iowa.
We do have a Facebook page,
Okay.
a Pottawatomie County WIC Facebook page that we do post things periodically to, breastfeeding messages as well as groups or that kind of thing. And we do have we try to get all the resources in the county. As far as breastfeeding support groups, there's one at both hospitals, and then we also have breastfeeding classes at the WIC office that we have dates for set out. So we have those that we hand out to. Any other questions?
Great, thank you, Chris. Okay, and for City Health, Rachel?
It's actually Tanya, right? Came instead of
Oh, I'm
Rachel.
sorry.
That's okay. She was gonna come, and then it's her 40th birthday this weekend, so her husband flew her out to see her best friend.
Well, that was awfully nice.
Yes. So I have just a couple reports that I had pulled. I don't know if you guys got them back there. But the first is the school audits.
Also in your packet, I have it broke out specifically what the city did. It looks like this. But I pulled the report where it has the combined numbers where what the city did and what the county did. I conducted all of the school audits, so it was over 12,000 records that I looked at. And childcare, Rachel and I split those, and there was 1,600 records that we looked at. So those were all done, and we did those October, November, and December, and had those completed. And I was very glad to not be looking at dates anymore, which I'm sure you understand that. Then my other reports that I pulled, we have a disease surveillance system for the state of Iowa, and they have some really good maps and things in there. I pulled the confirmed cases, so those are on the front page, and then the map is what the whole state has. And then the probable cases are on the second page, which it's kind of funny, on that page, a lot of those were confirmed cases, like the Rocky Mountain spotted fever were confirmed, so I'm not sure why those were on probable. And then I went back through and broke out who was in the city limits and who was out in the county, and wrote those numbers off to the side on what we did as the city health department and what the county did. And then you can just look at the state maps just to kind of see what kind of numbers are across the state, which most of the numbers are in Polk County, obviously, because they're the biggest one. So that's that. We have the head lice kit program through the Dodge Trust Grant, where we supply mineral oil, vinegar, shower caps, and a head lice comb. We make a booklet and we provide it to residents within Council Bluffs. If they have head lice, they can come in and get this kit for free. So for 2017, we treated 188 people with those kits. And again, that's all free of charge to people. And they can come in and we recommend treating the whole house with that. We had a few, the last couple months, immigration letters for tuberculosis to follow up if they had positive skin test upon immigration. The immigration will send that to us, and then we send it out to the people and tell them that they have to see a provider within 30 days and report back to us the chest x-ray, or if they have the blood test to confirm the positive skin test. And if they need latent TB treatment, then we provide that to them for free through the state health department. Or if they're active TB, then we take the active TB measures where we'll do a full contact investigation, collecting sputums and DOT treatment, directly observed therapy. So far, all of them have come back with the blood test being negative, so none of them are doing the latent TB treatment. So that's all I had.
Thank you.
Any questions? No?
Okay, and public health nursing, Joe.
Well, each of you received a notebook. So I didn't want to scare you, so if you look through it, it has a lot of different information. It is for public health in general. Normally, and Dawn will come out and try to do a orientation to the new board members down the road. But I wanted you to have some information up front, and then, because I didn't want to overwhelm everybody all at once. Yeah, so I want to direct your attention to the tab that says members. And Amy had called me the other day and wanted somebody's phone number, you did, and said, gosh, I wish I had it. So I have a different format that has to go into the state that is required. But if you look at that, make sure everything is correct on that sheet. And if not, I'll change it and get back to you. But, and Dr. Guzman, to the state, we need your license number. But I will not publish that anywhere else except on the state document.
My medical license number
Yes.
for Iowa?
And you will get it from you later. But that's one of those things I don't like just floating around out there. So, I don't know if you do, but
Yeah, as long as it's not my DEA number.
we don't need that. We just need the medical license number. So, and Matt had sent me this document, or had handed it to me at the last meeting, so that, but I do want to, so you have it in case you want to code your phone into any numbers. So, the other thing I wanted to point out is under the contracts. And when we talk about what different things the different agencies do, in our contracts, the state requires us to specify what they have approved for us to bill. So both the contract for the City Health and the contract for the VNA is in there between the Board of Health and those two entities. And then it's all pretty much played right out exactly with the definition of what those activities are. So of course I can't find mine. So the VNA does a number of different things, and what we bill toward this grant is listed there. And it's on like page 2 and 3. So some of the things that that we do that are billable towards the local public health service grant are disease investigations. And under disease investigations, it's not just investigating those diseases, but it's the child audits, it's the case identification, prevention and spread of disease, if we're educating. There's some of these things that kind of you can bill under 2 different entities, so you bill only just one, whether we put it under education or we put it under prevention and control of spread of disease. We do the community health assessment, we do immunizations, although we also have an immunization grant from the state, so rarely do we ever bill the public health entity for immunizations. And we also are able to bill Medicare, Medicaid, and some insurances for our immunizations. So it's a rarity for us to ever bill immunizations here. We provide health education, screening and assessment, and for VNA, we do screening and assessment at the residential correctional facility. We do it at a couple of the assisted livings where we go in, take blood pressures, and screens. We also provide some services out in the county. We'll do blood pressure screenings, we'll do different sites, different dates out there. So certainly supporting the Board of Health. Collaborative relationships is big because it's going to the different meetings that we attend. That would include the Breastfeeding Coalition. That would include any of our Title or McBee funded there too. We have different funding sources, so we try to maximize our dollars by only billing where we absolutely have to. So I'm not going to go through all that. I just want you to know it's there. And Ms. Fox, when you talked about how you would like it broken out, I can break it out by each one of those entities and by the number of hours provided, if that's what you'd like.
I just see financial
No,
statements.
that's fine.
And I just
Well,
thought you had one, so.
I'm not an auditor, so
Yeah, okay.
nursing is my background.
Yeah,
So I also want to direct your attention to a document that's in your folder. Looks like this. It's actually what we have done through the VNA for the last 2 months. So from meeting to meeting, I will put hand a document to you that will tell you what we've done. So for us, this last 2 months, we gave 143 kids immunizations. We gave 81 adults. We have this year started a nursing visit program, and Karen is doing those. Those are to adults that do not have any insurance or any other payer source. So if we can put them onto something else, we will. But these are the ones that kind of fall through the cracks, don't qualify for anything, but yet do qualify for the public health nursing grant. So we had a total of 11 visits there, but only 6 of them went to the grant. We are part of the biopreparedness, the 11 county biopreparedness group, coalition. We used to be 3 counties and now we're 11 counties. And we are also part of the City Readiness Initiative, which is a group that is shared by Douglas County, Sarpy County, Washington County. So there's Mills and Harrison County. So it's preparing for the H1N1 or whatever we did before. So in our county, we did a total of 5 disease investigations the last couple months. We do a lot of education. We do Family Works, which is a program for drug parents that have gone through the drug courts and are sent to where they actually live there, and we provide with education to the parents the mothers every 2 weeks. We do a lot of education we see the shelters. In the last 2 months, we saw 112 people at shelters. So Diana goes to the Phoenix House, and in those 2 months, she saw 26 people and did assessments on. So public health referrals, RCF, I think she said she saw 21 there. Our Nurse Family Partnership Program, which is a nurse visitation program to first-time mothers, and we admit them when they're pregnant before they're 28 weeks. It goes on until the kids are at the age of 2. We did 195 home visits in the last 2 months. And the WIN program, which is slightly different, but it's also done by a nurse in a home and a social worker. That program will see any child under the age of 5 with the parents. So they did 25 of those visits. Homemaker, and I am going to let Karen tell you a little bit about Homemakers, but in the last 2 months, they did 1,054 hours of service. And of those hours of service, 379 were billed to the local public health grant. So that means the other hours are a waiver. The elderly waiver pays for some of it. Some of it is paid for by Medicare, Medicaid. So it's stretched out as many as we can see in a time frame to use the best dollars. But I'll let Karen talk about because she wants to talk a little bit about Homemaker and what she does. So, do you have any questions? We do a little bit of everything. We're a jack of many, and Diana did complete the audits for the schools, and there's actually a letter that we usually present to the board that talks about how many we saw and what the statistics are as far as percent vaccinated and those with certificates or those without. So.
My one question is for the education pieces that you do to outreach to patients. First of all, that's fantastic service, and thank you for what you do with that. But how often is the information material updated, and who does the updating for that?
Believe it or not, it is pulled off the internet or out of Diana does some better choices, out of the most current database that they use almost right before the class.
Okay, perfect.
Yeah. We at one point we decided we'd start a big drawer and we put stuff in it because it would make it easier. But as I did one the other day, it was on health hazards to some students at Canesville. Every time you pull it up, it's updated continuously. So yeah, we decided we had a storage problem anyway. Good reason to have to pull it off, and you never know for sure how many you're going to have to give. It just changes. For Canesville, I may hear tomorrow that I'm going to talk to 12 students, so I'm only going to take 12 or 14 items to I don't make too many copies if I don't have to.
Very good. Save some trees.
Exactly. Well, I try, except if you noticed when I wrote the notebook, put the notebook together, I killed a few trees.
Well, that'll last for a year.
A year, yeah.
The nursing home visits that you're doing, do you have a resource at each nursing home to let you know of the patients that need that, or how are you making your contacts there?
When we're you mean for like the screening and assessments?
Right.
We routinely go in. We set it up, we do Prime Square is one that we do, which is really nice because we just go out our back door. But it's on their calendar for every month. And she goes in and we usually hand out, if it's a month that's heart month, we'll hand out heart information. We'll pull stuff off the American Heart Association.
And are you out in the county too, or just in the city?
We used to be. We used to actually have a line item in this grant that talked about senior sites, and they took that away. And when they did that, they weren't willing to put forward any money, a lot of the sites. So sometimes we'll just go out once a year to those. We have Camelot right now, or not Camelot, we went to Camelot already.
North Avenue.
North Avenue Towers and Prime Square that we pretty much routinely, and we have people come down we'll have anywhere, well, as you can see by that, we, in a 2-month period, when we were at Prime Square, we saw 16 different residents.
And fairs too, we're asked to do screening at fairs, blood pressures, so last one at Alto Avoca, we provided both flu shots and blood pressure screening.
So if the rural ones would consult you, you could go out there, but you don't really have a routine.
We used to do immunizations out in the county, and we really found that, I think one year we did like 11, if you didn't count the flu season. If you took out the 8 months without the flu season, we only saw 11 people. And we provided 16 hours worth of service for 11 people. So we decided that that wasn't the best use of our time. So certainly we will go out and give those shots at a school. We've been to Danson shots at Riverside, Tri-Center. I mean, you know better.
Well, and it's kind of on a need-to-need basis. If someone calls me and they can't get into town, I will go out to Avoca to the WIC clinic. But it's kind of by appointment because we found that we were sitting there for hours and not doing anything, and it was not a very cost-effective way of, being a good steward of the money.
Sure. Are there any other questions? Okay, Joe. Oh,
When you mentioned they took the money away,
The state. They, not you. Nobody else.
sorry, Tim.
Actually, and you know what it is? It wasn't so much that they took money away. The state didn't pull money back. They just made the decision not to fund that service, is what it came down to. At one point through the years, they broke out the funding, so this much went to Homemaker or elderly. They called it for the elderly services. And then this much went for just public health. And this much was listed as Board of Health. And then we had senior service, or senior clinics. Well, one year, the first year they got rid of the senior clinics, said, oh, you can do that under screening and assessment. We don't have to line item it out. Well, last year they removed chore from the options. So every year the state comes out and says, this is what you can spend this money on. Legislatively, they've made those decisions, and then we have to try to make it fit. We've continued some of our senior sites just by doing the screening and assessments.
It's not just Pottawatomie County, it's all.
It's
a
across
whole-
the board,
yeah.
yes. It certainly isn't a decision our county made. But I'd like Karen to talk about the Homemaker program, just because it's totally different from what I do.
Okay, just a quick little note. I'm not a very good speaker, but it's really been very rewarding for me. I've been here about a year now. We kind of developed this. We would go out and I've tried to market it to a few of the doctor's office. I've been to the CHI clinic too, talking to some of them with the social workers. But we've gone out and we've set up a Homemaker program, which we've had, and it's been such a benefit to the seniors out there, 60 and older, of people who can't really maintain their home. It's amazing as they get older, obviously, even moving the vacuum is tough. And so we've set up, it's more of an environmental safety kind of thing. We're not going to go out there and scrub down windows or do anything big, but just to have someone go in a couple hours a week, and we help them with wash. Most of the seniors right now have laundry facilities in the basement. It's very unsafe for them to go down to try to carry wash up and down the steps. And just basic wiping down bathrooms, kitchens, washing up dishes, maybe helping with meals. They run errands for the seniors if they, like this time of year, we really see an increase. They can't get out to the store, and there's not family available willing to do that running for them. So, and with that, we've kind of put our foot in the door with trying to help out with, I would go out and make a skilled assessment, check on their medicines and check on safety concerns in the home and how things look, and then make referrals as we need. We're really pretty fortunate that we have kind of the VNA and our wings here that if it does look like something that's not going right, we can call the doctor's office up and say, I've noticed that they're not taking medications appropriately, or maybe, if we've noticed some blood pressure issues, I'll do vital signs when I'm there. So it has been a real benefit. I had a doctor's office call once and say, would you mind just running out and I don't think he's taking the pills right. And so I did. I ran out to see and it was amazing. We just went through the medicines, and I had the list from the doctor's office and his list, and obviously they didn't match. And so we kind of got that figured out. And it's kind of a nice little benefit to have those county funds to make that quick assessment and not really, have to, go out you don't really have to make weekly visits, we can, let, home care do that, but at least make that initial assessment to make sure they're safe in their home. So, anything else,
So you're the only one that does it?
I am right now, yes. Yeah.
Well, and you might explain too, the connection within that realm, if we had clients that were, had medical, had skilled needs, then we would, look to, is skilled home care, so, sometimes we have clients that kind of flow back and forth between those programs, but I think what Karen's really found in the last year is that a lot of times some of our elderly clients in their homes, even when you meet those basic homemaker, or maybe bathing, help with personal care, that there are times when it really takes the skilled eye to be able to look, and sometimes being able to intervene can really keep somebody out of trouble, out of the hospital, or, avoiding a fall, that kind of thing. And so it's been nice to be able to have that flexibility, feedback is coming from the staff in the home, that they've got concerns, that, that allows some reimbursement for Karen to be able to go out and assess it at a bigger level, to have some communication with the physician if needed, and, maybe even bring on more services or referrals, so.
Well, this seems like a big load for one person,
Well, actually, we're just kind of getting started. We've really been marketing, well, the Homemaker's been around for a while.
Yeah.
And so with that, it's kind of our foot in the door to kind of make the assessment and then, let them utilize resources within the community. So really, and, we do have funding from others if they need ongoing services like Medicare, Medicaid, things like that. And I can't say that we always need to branch out, but we have found that there's been a number of people then that once you make that initial foot in the door, then we can get other resources in there and really help them out. So, and it's been very rewarding, I've got to tell you. So even a couple success stories really make you feel pretty good. So.
And I want to let the board know too, we do have a Facebook page, Potawatomi County Public Health. And so feel free to like us. We don't have a huge number of likes, but we do put stuff, anything that the state sends out, we'll put on there. If they send out a news release or anything, I do put that on. So I'm not the greatest social media user.
Are you managing that personally then, the Facebook page? Do you mind if I jump in on the Facebook page and you make me administrator so I
not
can
a problem.
do some work with that?
Yes, love it.
An important part of this social media is networking into other already established groups and letting them know we're here, and then continuing to provide a lot of services through there so people eventually start subscribing. So I think we can
Yes,
do a lot
I
of
love it.
expansion from there. And it could be a very good point of contact for the entire county for many of the things that we do here.
We've got some interesting notes written to us, sometimes I've had to refer to Dawn Dirks, who is the city health administrator, because somebody was complaining about trash or smell coming from a certain area in the city. And so certainly we've had some on there, but not a lot. So we'd love to expand it.
And what was it called?
Potawatomi County Public Health.
Okay.
It's got the apple
Okay.
on the top page.
Okay, so moving on to Potawatomi County Public Health member information.
Well, your notebook is there. I think that just deciding a time when Dawn can come and do the orientation among you, all three of you, when Barbara gets back. But I wanted to give you something to.
So Dawn Mao is a consultant from the state, and you saw her, we met, she was one of the team members at the meeting the other evening. And she does do some work to help orient new members to the boards of health. And it's to our advantage to, because this is a complex, as you can see, network of many grants and people and what our role is and where we go from here type thing. Have a meeting with her to help us get all your questions answered and get a little bit of an orientation going that way. So that adds us another meeting, so we have 2 meetings between now and our next meeting, probably, where we can work with getting some orientation done to help with that, so. And then in the meantime, there is a lot of information right here in this notebook that you can sure peruse and see. Please,
Light reading.
yes, please feel free to reach out to me or Amy as well if you have any questions or anything like that. But we would like to give you a little bit more formal orientation to the Board of Health, and so I would like to schedule that. Is there any other business or discussion to become before the meeting?
I completely left off Rachel's piece.
Okay.
When I was up there, and I apologize for that. This paper that's in your packet is, we have the free STD clinic that runs through our office. Tests for gonorrhea, chlamydia, syphilis, HIV. So these are all of her numbers, and locations that she's been at for the month is what that is. And then also, this is her year-end report that kind of explains exactly what she has done, where she goes, things of that nature. So another light reading that you can do with that. She also started going down to Mills County and Montgomery County. She met with them this week to set up some clinics that she's going to go out every week and hold STD clinics and HIV testing out there with a new grant that started January 1. So she's going to be starting that, doing more outreach throughout Southwest Iowa. So, and maybe Linda can expand a little bit more on that too. Do you have anything to add with that?
No, basically this is, we're just starting this, and hopefully, because Mills County has told us in the past, some of those teenagers cannot get to Council Bluffs. They don't have the transportation. So we're hoping to reach out, and with the increases in numbers, we really think it's needed. A lot of our family planning clinics have closed in southwestern Iowa. I'm already getting calls like from Bedford, where do I send someone who needs family planning services? So we're hoping this will kind of help a little bit with the STD rates.
So, in regards to that, what are we doing to make public the knowledge that we have these existing services to people of Potawatomi County?
I think Rachel is starting a campaign program. She's advertisement that she's going to start very soon. She was working on that. I haven't heard when that's going to start, but should be soon. Should be soon. Plus, those counties are going to be advertising within their areas.
And this is all new, starting January 1.
Brand new.
Reaching outside of Potawatomi County.
All right, excellent.
This was a competitive grant that they were able to obtain. It's for 5 years. It's $154,500 per year. And in the past, this is going to be the first year that you'll see a heavy advertising campaign go out. There'll be billboards, radio ads, possibly some TV things if we can get some things on TV. But in the budget, a lot more money was built in to do a bigger presence for that, because that's kind of one of the initial things we brought up was we've never really heard of these things before out in the past year, a lot from Douglas County and what they do, and so this will be kind of a big push by the city and the expansion of that grant.
Okay. One more thing, are we partnering with any of the major healthcare players in the area, like CHI, Methodist, even UNMC over on the other side? Are we working with them at all to have them help us with this campaign? Because, I mean, I feel like they probably have a lot to offer in reaching their patient population as well.
I go into the private doctor's offices, and I do want to make an appointment with you for the near future, but we offer condom distribution through the state, through Rachel, where you can have free condoms available. It doesn't have to be doctor's offices, it can be bars, tattoo parlors. We're looking at where can we reach the high-risk people. I also do the STD education, what's available, the free clinics, and STD reporting according to state laws. So, I try to reach out to those private entities and make that relationship and click it and let them know, look, partners need to be treated. You either have expedited partner therapy law where you can do it without seeing them, or you can send them to the free clinic. So I do outreach there.
Okay, so like on a clinic by clinic basis. I
Yeah.
was thinking more along the lines of partnering with the organizations themselves. If we're gonna do a 5-year.
With Rachel
Yeah.
directly, yeah, that one,
And Douglas County has a free STD clinic as well, that they
which
do
we
over there.
advertise, yeah.
So,
So are we working with their, county health department or
yes,
to, like,
she works with them
combine
directly.
together to make this
Yes.
massive campaign for the entire metro area?
And they
Oh,
do
you mean the
work-
advertising part of
Right,
it?
yeah, just a large campaign. I feel like we have everybody on board for one big push to say Omaha and Council Bluffs are trying to completely get rid of HIV, test everybody for hepatitis, Hep C, everybody that qualifies for any of these things, gonorrhea, chlamydia. So, I mean, it sounds like we're trying to embark on a very
Yeah.
big project here. I mean, if we have all the major players coordinating with us, we might be able to make that push as big as we can.
Yeah, Omaha's had these high rates of New York rates for probably 7 to 8 years right now. And
everything's
they've had the
too.
money, we haven't really had the money until just recently for the advertising. And Rachel does work with them, but I'll talk to her when she gets back too.
Is there a stipulation on that grant as far as where you reach out to?
No, it was,
I
just,
mean, I
just a
didn't
line item in the budget for advertisement.
Yeah.
Yep, and the state gave the okay on that. Any help, since this being the first time going through that, any help that we could get from you would be excellent to get those partnerships to where they can bring it all together.
I think they'd all be very interested, because this is a very big issue in this,
Oh, yeah.
this whole area. So I think they'd be more than happy to if we reach out to them.
Yeah, I'd like to see more, in the private offices, more HIV testing. It's not happening right now. If someone comes in and says, I want to be checked for STDs, an HIV test is not included in that. But when I talked to the people that are positive, they thought they had one done. They thought their doctor said they were okay, everything was negative except the gonorrhea. So there is a lot of confusion there. I would like to see more done in the private sector. With the family planning clinics that have closed, I need that private sector right now. I need them to be the champions because there are very few services there. And I don't know where Rachel is at with the advertising and thing, but I can mention that to her that, I know that we also have the, meetings that you do
yes, we have.
where we bring in the hospitals, both
Yes,
hospitals, don't we?
Back in 2004,
Yeah.
part of my immunization grant, we had to create a coalition or task force for immunizations and communicable disease. So I created that, and we meet quarterly at Mercy Hospital in one of their rooms, and anybody can come. It's open to Southwest Iowa, and we talk about, people can bring anything to the table, but we talk about what's going on in the community, what diseases we're seeing, what spikes we're seeing, different things like that. So those are very helpful. And
Yeah.
a lot of the doctors are on our listserv that read the minutes that can't attend the meeting. So we sometimes will get responses back from doctors asking for more information on something specific. So, and to add to the HIV, this is the first time that they've opened up HIV testing to anyone who
Right.
wants it, where it has been with the previous grant, it had to be the
It was
high-risk
limited.
people.
And you had to have them tell you a high risk that's on the list.
So we probably will
Yeah.
see more of a spike because the
Yeah.
testing has now been opened up to
To anyone.
No questions asked. So,
Yeah, things are changing, and I would say this is the first year where it's been more open for us in public health to do more. But we have tried to reach out to, the main entities in the area on a regular basis. So, I've done some in-services recently within doctor's offices. I have like a 45-minute presentation I can do. I usually do them like over their lunch hour, lunch and learns type thing. So we do offer quite a bit, but the push is to get the private sector to do more testing for us.
and we have big testing out at Iowa Western, that she
Yeah.
goes to. So that's a lot of the clientele is out at Iowa Western. So she'll go out and test say on Wednesday, and then she'll go back the following Wednesday and do treatment, and then get partner contacts and try and get them in, to do that. So that's where a lot of our patients come from, is Iowa Western.
You just CC me in any emails if possible that are going on about discussions with this, and I'll see what I can do about talking to at least CHI, because I might have some contact with them about possibly partnering with us on helping the advertising and maybe enacting any kind of guidelines for their clinics to do the HIV testing. Because there's different ways they have in place already to push certain recommended guidelines from higher up to their providers, where it kind of
Yeah.
comes up with every single.
Which
note,
has
we
to
need
be
do
in the
these
Omaha
things.
side, is my understanding. In the end, it has to all come from them, which I've been told in the past, which sometimes can be a challenge from this side.
Okay.
So, yeah, any help we can do there to get that changed quicker would be great.
Excellent. Thank you.
Do you have a card with your email on it?
My email? Yes.
That way we can add you to our stuff.
I'll get that to you afterwards.
Okay.
I did want to add, I do promote at RCF because I feel like there's a lot of high risk there, as well as our Heartland family because of the substance abuse. And so I think as partners, we've been promoting.
What's RCF?
The Regional Correctional Facility
Where's that?
on 9th Avenue,
Oh,
the work release program.
okay.
Yeah.
Okay, one more thing to come before the board. We have a invitation to honor Amy, who is going to be honored as the Parents as Teachers National Home Visitor of the Year.
Wow.
Oh my gosh, Amy.
And that reception's January 28th from 2 to 4 p.m. at the American Legion in Avoca. So, good work, Amy.
It's open to everybody.
Yes. All right, is there any other discussion, questions, concerns? Motion to, were you gonna say something, Matt?
No, you're fine, I was
Okay.
gonna stop the camera.
Motion to adjourn,
I motion that we adjourn.
Second.
all in favor?
Aye.
All right, the meeting is adjourned.